Well, hi, everybody. Happy Monday. Well, in case you didn't hear the good news, Positive Approach to Care made it through the tough months of COVID and we got our PPP, so hooray! Thanks, everybody, for all your support. If you were somebody who shared or liked or even donated money, which can't believe all of you did that, thank you so much. You helped us get through, and we are now able to continue offering free consults and free time and free support for those who need it most, and hopefully for the rest of you, support that's on the cheap, because we got to do what we got to do to keep the doors open. So thank you, thank you, thank you, thank you. Before we get started, I wanted us to talk a little bit about dementia in general today, and I'm gonna pause and sharing. So for the team, because I'm going to go back a couple of slides real quick. For the team, what do you guys know about what other scales exist out there? How do people generally talk about dementia? What kind of scales are there to tell us how far along someone is in the journey of dementia?
I want to hear the most is mild, moderate, and severe.
Mild, moderate, severe. Yep.
My favorite is, my least favorite maybe, is global deterioration scale.
Yeah, that global deterioration scale. There are a couple others. There's the Allen cognitive scale. There's a lot of ways that we can sort of say where someone is along this cognitive journey. Unfortunately, not a lot of them are especially nice. So what we at PAC are trying to do is kind of change the framework a little bit. So let me go ahead. So this right here is our model. This is what we, oops, let me see if I can move you guys so that you're not hiding the stuff. Here's our model. Our model is the GEMS, and we really do believe that this model should be skills-based. What can I still do at every step of this journey? If I can't still do anything, well then I wouldn't be alive. And so that's not an accurate assessment. If all we focus on is what's being lost, then you're missing the fact that I'm still here. And so we really try to see at each step of this journey, what can someone still do? But we do know that along the journey, things shift, things change. People need different supports that can make my skills shine. So the GEMS model is really based on the Allen cognitive levels, those occupational therapy pieces that talked about skill, but instead of skill lost, we talked about skill retained. So here's that global deterioration scale that Beth and Catherine were talking about. And we're just going to click through, and I want you to notice some of the wording that's used in this very common scale that describes people that we love, people that we care for, people that are our friends, people that are our family, people that are, the person that you see on a daily basis, even if it's at work. So let's just take a look at the words used and see what you think. Oh, wait a second. What do you notice right here, right away? So guys, what words stand out to you here for the GEMS model?
There's no decline.
It's not a declining model. Yeah, it doesn't go in order of worst to worst to worst.
Positive words instead of negative words.
Some positive words in there. Beautiful moments, even at the end.
Nothing is defining where they are in the journey necessarily.
Oh, it's not a stagnant stage. So once I hit this mark, I will never go back up. Well, it's not really how people work, right? People sometimes are here and sometimes are here. And we've been talking the last week and 2 weeks about how we are all these gems at different moments in our day and our lives. Yeah, so it's not a stagnant stage. These are states, gem states. So now let's take a little look at some of the wording used in the global deterioration scale. And let's see what stands out to you there. No cognitive decline. Oh, let me move you guys just a smidge more. No complaints of memory deficit, no memory deficit evident. What are you seeing so far? Any positive language, even though it's positive things? Any positive language here?
Also, I'm not sure it even applies to me on most days. Apparently, I don't have dementia.
Right. Yeah, this doesn't leave a lot of room for error. And yet, how many of us make errors throughout our day? How many of us do have memory deficits? How many of us? And so already we're starting a fear-based system because, oh, I'm not at the bottom of this scale. I'm not the lowest amount. Oh, no. All right, let's keep going. And we're not going to read through all the words. What words pop out to you on each page? Just a smidge more.
It's very verbal based.
Yeah.
Oh, so the language on the left that we're losing in many dementias, if all I'm looking at is what language you're losing, is it going to be pretty quick when things start to fall apart in my left temporal lobe?
Or worse yet, what about the people that don't have language? Well, can I never use this scale if they haven't developed language due to, let's say, an intellectual disability?
Oh, yeah. So not everybody can even go on this scale. Shoot. Well, now we're using something that isn't really good for assessing everyone, and yet it's the number one scale that people are using. So we'll just keep going. So MCI is where a lot of people are told they are. MCI is mild cognitive impairment. And there are quite a few people that this is it. This is the end of this journey. According to this scale, you have MCI and it will never progress into a full-blown dementia. Well, that's true for some people and not for everybody. But word and name finding deficit becomes evident to intimates. There's just little pieces here and there that just don't make a lot of sense when you're really trying to do an assessment, because this is looking at very specific skills. And as Beth said, if I've never had those skills, or if I lose those skills early, but I retain the rest of my brain for much longer, are we looking at any of the skills that I can do? Have you seen a single thing that I can do in here? Patient may have lost or misplaced, objective evidence of memory deficit, anxiety. Is there anything that's showing me what I can do? Not yet. Well, it's only downhill from here. So now we're clear-cut deficit on careful clinical interview. Whatever that means, clear-cut deficit. Unfortunately, how many people are going in for regular baseline screenings so that they can show a clear-cut deficit versus this is the first time that I've ever assessed in a clinical interview. And so what am I showing a deficit of? A deficit to a baseline, a deficit to someone else, a deficit to how other 36-year-olds should be behaving? What is this compared to? If it's not compared to me, what are you comparing my deficit to? So you start to see here some words that are pretty strong. Down here at the bottom, denial is dominant. Huh. Hold up 10 fingers and put down 5 of them, because this might be true for 50% of people. I have no idea that things are changing. I'm unaware. I'm not in denial. My brain is actually telling me things are fine. It's everyone else that's the problem. I don't know what you know, it's just that daughter of yours. She's the one. If you don't have her come over, you'll be fine. But uh-oh, what's on that other hand? You've got 50% of people who are aware that changes are happening, and they're the first ones to notice it. This scale doesn't say anything about those people. Huh. So we could keep going. As you'll notice, wow, what happened here? Yeah, and then we keep going. And basically at the end here, what are we saying? Are these people anymore? No, we're seeing these as things that need our help to stay alive, because basically nothing's left. So hold up 3 fingers, because what this scale focuses on is that, yeah, at the end of this thing, you only have 1/3 of your brain left. And what we focus on is, hey, at the end, even at the end of this thing called dementia, you still have 1/3 of your brain to work with. It's a reframing of this scale that really looks at what you can't do anymore.
Amanda, I like the way you said that you can work with.
Yeah, because is it going to be obvious? Is it going to be evident that I can still do things? Maybe not, because I might be missing a hell of a lot of wiring. But if you can get me from point A over here to this storage cabinet over to point B, and you start the motion, my brain will go, oh yeah, I know what this is. I got it. You know what, lady, back off. I got this. But unless you try to give me that autonomy, you'll never know it existed in there. So what are the 2 main differences between these 2 rating scales?
One's very negative.
Yeah, one's really negative. All it focuses on is loss. It's called the global deterioration scale. How much are you deteriorating?
But it also looks at what's gone. I mean, that's the difference between.
That's the thing we're looking at. Whereas,
Yeah.
what does that GEM scale, what does it look at?
It looks at what's still there.
Who are you?
Who are you? You're a
What can
person.
you do? And who are you?
Mhm.
So why do we use this scale? Why do we use this GEM scale and not that other scale?
Because the other scale, the hardest thing about it is, and there are ones that do have some functionality, but it's not just about positive rosy. It really is looking at the difference of, I've got a lot of living to do in this 10 to 20 years I might be living with this disease. And if the only thing you're learning about me is what I can't do, that's not all about dementia. A lot of things change. And so it's really about functionally interacting with people wherever they're at any given time.
Yeah, so it's not just about painting a rosy picture of dementia. Dementia ain't rosy. We get that. But I can still be who I am through a lot longer in this journey if you're willing to try to let me still do a lot of things that I can still do. So yeah,
Also,
that,
oh, I'm sorry. I was going to say that also the first scale is very specific about what you can't do. However, all dementias are not the same. So the change you're going to see may not fit in. It may be a round peg in a square hole.
absolutely. So, and each person is different. You know, they say, yeah, no, one person living with dementia, you know, one person living with dementia, and each journey is going to be really different each day, each moment. How many of us find ourselves going through these gyms on a daily basis, depending on the situation, the people around us, my sleep pattern, my disruption of sleep pattern, or whatever else might be affecting. So, you know, one type of dementia, you know, one type of dementia, but even from one person to the next, that dementia might look different. It might attack at the brain differently. It might depend on other health impairments. When Beth said 10 to 20 years, that's for some dementias. Realistically, we're talking 6 months to 30 years for the over 120 different types, causes, and forms. In the unpredictability, there is some predictability. And that's what these scales are trying to do. The way that we frame it and the why of what we frame it as, if you look at me in this moment, what am I capable of? Then we'll both be the most successful we can be, because we do have tasks we've got to get done, and we do want to maintain a relationship. That to us is the most important thing. So we talked a little bit about this already, but how does it affect families and care providers, friends of people living with dementia, to use talking about someone in GEM states rather than a global deterioration scale?
I think it gives opportunities for family members to remember who they are and to find joy with them rather than looking at the loss.
Yeah, when all I see is who you used to be and I want that back most of all, it can be really hard when all I'm being shown is the loss, the loss, the loss. What the GEMs do is make you look for the things that you still can do, even if it's different than it used to be. Keith, what else?
Similar, but I was going to say, instead of just grief over everything that's being lost, there's some hope about joyful moments that you can have going forward.
Oh,
And
there's
connect-
something I can do. There's something I can try. This is not a brick wall. I haven't hit the end here. This is just the beginning if I'm willing to let go of who you used to be and grieve. Yes, grieve, but not with me. Not in this way, not in front of me where all you show is that you're sad that I'm here. Find a way to grieve. Grieve those losses, yes, but then also look at what I've got and work with me to help. So, team, what's one change in thinking or language you will make given these two options? And it may not be a change for you guys, but what's one change you hope someone will make? Because a lot of you use this stuff all the time. But what's something that you hope someone else will make a change, make a step in the right direction?
I'd like to hear that people say that someone can versus can't.
Someone can versus can't. Yeah, absolutely. Any other pieces you wish you would hear out there or you want to see people moving towards?
Go ahead, Gary.
I like hearing when people say, suddenly I am not frustrated any longer with that conflict.
So taking a moment to recognize conflict and taking a time out to say, what else can I do, instead of feeling like this is all we can do.
Mm-hmm.
Yeah.
I like the idea of, that we talk about is seeing everyone as precious and unique, and it expresses itself in different ways. And if we can continue to look through that lens, if people can see, oh, they just need the right setting and the right care, just like any gem, and it can be magnificent no matter what color they are.
Yes. So that beauty of looking at each person individually and really, really each moment with each person individually. Keith, anything else? I looked like you were going to say something.
Yeah, so when we think about retained abilities and characteristics, that helps give us motivation to understand that we need to change a bit to go along with that instead of doing what we've always done or keep doing what's not working.
Yeah, those old habits, those ways of being with that person, if I can let go for just a moment and be here in the moment and just look objectively at it, be a detective rather than being a judge, and say, you know what, I wonder why every day at 3 she's doing this. I wonder why this is happening, instead of, oh, here it comes again. Taking that moment to pause and get curious is really hard, but really key to letting go of those old habits. So, how likely is it that given all this new stuff that we're asking you to do, you're going to make some mistakes? Yeah, go ahead and nod, because this is, if you're here for perfection, then dementia care is not for us. Because perfection is just not achievable. We just can't be perfect. So get really good at these. I know we went over these last week, but these are ones that we'll use time and time and time again, and you'll get lots of practice with them. Because I'm sorry, I was trying to help, with the right tone in the right space, can have all forgiven. Or, I'm sorry, I was trying to help, could also make nothing forgiven. So really taking a moment to check these out. These are the I'm sorry phrases, and we have a couple of cool downloads on our website if you want to check those out. They are free. You can go see how they are. I don't know if the I'm sorry's card is there on the resource page, but if not, reach out to us and we will make sure you have this as a downloadable PDF, because it's a really good one to have. But there are some posters that you could buy that have these on them too. So if you are interested in growing your skills more, Tipa is still pretty free right now. She's not back in person. She's running 2-hour skills sessions. They're only $50. So if you and your family or you and your friends at work and you have some questions and you really want just a little taste of what PAC offers in a more skilled and structured setting, you get a little bit of one-on-one back and forth with Tipa, who gets to see what you're doing and give you feedback, and you get to try out some of the stuff that we're talking about. And 30-minute consults, still an option for people, free 30 minutes. Go on to our website and check it out. And then keep supporting us with your likes and shares, and our YouTube content is growing daily, thanks to Carrie and team, and we are continuing to put up lots of new stuff. Tipa's playing around with offering some COVID-19 related stuff, so if you want more on that, keep staying tuned, because we will start putting out some teasers for when she's going to offer some sessions, webinars on how to stay safe with all of this stuff, but also stay sane by trying to keep someone in their room all of the time when that's not really an option. So thanks everybody for joining us today. Happy Monday. Enjoy the rest of your week. We'll see you next time.
Hey folks, thanks for watching. Please like and subscribe to help us spread Tipa's positive approach message around the world. And don't forget to click the bell to get notified when new videos are posted.